Hello and welcome. You're with IndiaPostLive.com, India's first live interactive web television. I'm Nilanjana Banerjee. Well, you would have seen heavyweight politician Arun Jaitley recently. There was a cabinet reshuffle and he was given the portfolio of information and broadcast besides finance. He might be a heavyweight politician, but don't you think he's looking a bit lighter these days? Well, in fact, he has lost as much as 17 kilograms through something called the bariatric surgery. So we are here to talk about the bariatric surgery, what exactly it is, why do people get it done. Mr. Jaitley got it done for a type of diabetes he was suffering from. It does help in controlling a certain type 2 diabetes as well. Tomorrow, remember, is World Diabetes Day, and India is the diabetes capital of the world. As many as 10 lakh or 1 million people die every year of diabetes. So what is bariatric surgery? Basically a weight loss which is achieved by stomach size reduction. We'll get into the logistics and the details of stomach size reduction as well. The journey of the food is cut down. It does not allow sugars to build up, so there are hormonal imbalances that are checked. And if you can manage to regulate your diet, you will not gain weight for as much as 10 years. As long as 10 years. Okay. Now, what are the methods of reducing stomach size? Gastric band, removal of a portion of a stomach, or resecting and rerouting small intestines to the stomach pouch. This is also known as gastric bypass surgery. These are the three methods of reducing stomach size. Who all can go into the surgery? Those whose BMI, that's body mass index, is more than 33. Obese women with irregular menstrual periods and who are unable to conceive, and patients suffering from type 2 diabetes. So these are the people who can go in for the bariatric surgery. Remember, essentially it's weight loss, essentially it's to control a certain type of that's type 2 diabetes. But what exactly is the final benefit of the surgery? Of course, loss of weight. It is a weight loss surgery after all. You can recover from a certain type of diabetes. Improvement in cardiovascular risk factors. Naturally, you're losing weight, so cardiovascular risks go down. And possible reduction in mortality, from 40%, it can go down to as much as 23%. Of course, that depends on your age. It also depends upon the BMI that you started out with. So these are the benefits of bariatric surgery. India is the diabetes capital of the world. So let's take a look at the India's diabetes scene. It's the world's diabetes capital, like I was just telling you. In fact, how many people have been suffering? 37 million in 2004. That number increased to 41 million in 2007. And in the year 2030, we can have as many as 89 million people who suffer from diabetes. And also the statistics are quite scary. Like I just told you that India is the diabetes capital of the world. 1 out of every 6 Indians is diabetic. So you can imagine that is not at all a good number. And like I told you in the beginning of the show, 10 lakh people or 1 million people die every year due to diabetes. However, like every other surgery, there are adverse effects too to this bariatric surgery. Let's take a look at some of them. All right, gastric dumping syndrome, which is bloating and diarrhea after eating. So small meals and medication are required, 20%. Leaks at the surgical site, of course, you need a very good doctor and a very good hospital for that, 12%. Incisional hernia, as much as 7%. Infections, of course, post-surgery infection, 6%. Pneumonia is 4%. It can also have adverse effects on the kidneys. The fact that because your stomach size is reduced, your body is not absorbing too many nutrients, not absorbing enough calcium. You can have osteopenia, you can have hyperparathyroidism, increased risk of fracture. That's due to less calcium absorption. And because you're absorbing less nutrients like iron, vitamin B12, fat-soluble vitamins, thiamine and folate, you can have several nutritional derangements that arise from these sort of deficiencies. Of course, like every other surgery, there is also a mortality rate. It's 0.2%. If you have any more information to share, if you have stories to share with us, please get back to us at IndiaPostLive.com. Send us your tweets at #IndiaPostLive or @IndiaPostLive. We look forward to reading your comments and hearing your stories about this surgery. Remember, tomorrow is World Diabetes Day. India is the diabetes capital of the world. Let's all try to ensure that the figure of 89 million by 2030 is not reached. Let's hope we can control the number by then. Remember, 1 million people die every year due to diabetes. Let's try to have a healthy lifestyle. Let's try to go on walks. Well, that is something I tell myself every day, of course. And with the changing weather, hopefully I will start soon. So take care, all of you, and we look forward to your feedback. Thanks so much for watching. Bye-bye.